Hey everyone, I'm Christine Anderson, and I'll be leading you through the introduction of anatomy. And this is really maybe your first time diving into anatomy. Maybe you took a course in college and you found it dry and boring. Maybe you're taking this because you're supposed to and you need to. Or perhaps I encourage you to come with more of a curious mind to the world of anatomy. So, what is anatomy? Why is it important? And why are we looking at it? So, anatomy, this whole section is really about how anatomy applies to our yoga practice. So, anatomy is the structure of the animals and plants, and physiology is the function. So, we'll both look at the structure of our anatomical being and the functionality of the why. And so I hope it excites your spirit because this yoga practice is truly a Pandora's box. And this is one lens that we can kind of peer into and explore. A quote: "Yoga is the perfect opportunity to be curious about who you are." Jason Crandall. This is a way in to understand ourselves with a little bit more insight, maybe more reverence, more kindness, more compassion, more strength, and the list goes on. We can look at the world of anatomy for ourselves and how it relates to our bodies, and then have this kind of awareness expand of what happens when we look like when we're teaching. And how does that show up in the ways in which we sequence and we cue and we observe, and the poses that we even want to teach? When I first explored yoga, I had zero interest in anatomy. None. And I was very athletic, started yoga in high school. And for me, yoga was more of like an escape. It was this release, it was this connection. Now, I don't think I was able to explain what was happening and why I was interested back then. But I do know that there was definitely not an interest into the world anatomy. When I took my first 200 hour, so where you are right now, or maybe you've done one before, or you're looking to refresh and dive deeper into your practice and or your teaching. I'm just glad you're here. But when I did my 200 hour, I also could still care less about anatomy. I thought, subject's boring, it's not very interesting. And then it just kind of was this gift. And it made me really curious, just like this quote. And I started diving deeper into anatomy after my 200 hour. There was definitely curiosity there. And I started studying with a yoga therapist and a physical therapist. And he asked me the class rather, felt directed to me. He asked, "Are you practicing for the form or the function?" And during that period of life, I was very invested in Ashtanga yoga. I was super disciplined. I practiced 6 days a week in the morning. It's a very traditional practice, no music. It's self-paced. It's a set sequence that you're moving through postures. You're embodying drishti, your gaze, your bandhas, these inner energetic locks. You're staying in each pose really for 5 mindful ujjayi oceanic breaths. So it's very intentional, it's very focused, it's very disciplined. And I loved it. And then those are some of the reasons why I have so much reverence for it. But at that same moment when he asked that question, are you practicing for form or function? It dawned on me I was practicing really for form. There's a lot of headstands, a lot of deep shoulder and hip openers, and I was starting to experience some instability and pain rather in those joints. And so that moment was this catalyst that I want to practice yoga for the function of living well and being able to practice yoga until I die, into a ripe old age. So, why is it important in yoga? To understand how asana, how the poses impact our inner workings of our body. Like what's actually going on when we're, working in chair pose, for example. What's going on in the spine when we're doing a seated twist. It's also to understand where injuries may occur in the body and how to avoid injuring ourselves or students. If you gain more awareness, even at a foundational level, I'm quite confident it's going to increase your mindfulness in your practice, even if it's just one small area. And that creates a lot of excitement for me. And it kind of just continues to grow. And then we have more respect and connection to this body, this vehicle. So we're not passively moving through our practice. It's just another way we can actively participate with ourselves. It's also this place where once you have some base knowledge, you'll be able to assist an individual who may be dealing with a specific injury. I'm not saying you have to know anatomy at that level and that depth, um, but if there's some base awareness, if some student comes in and they're telling you they're having pain in their shoulder, okay, well, even from that moment, maybe tell them just simply, at this moment, we don't know much about anatomy unless you do. Hey, I recommend you remove chaturanga, low plank, from your practice for a while. That's just like the tip of the iceberg. Once you know a little bit more, you can create a lot more awareness for your students and how to move more mindfully in their lives. And then lastly, to be able to delve deeper in the practice. And that weaves even into the world of philosophy. There's a deeper connection to the body. When I walk around, I like to observe people in the trail and the park. I'm curious about their posture, how they're holding their bodies, not out of judgment, just out of curiosity. And what I find is a lot of us, we're so plugged into our devices and what's happening in social media and the world of work largely. But we neglect our bodies. It's like we somehow are just using the computer of our brain and not moving our bodies. So when we have more information about our bodies in our yoga practice, it really comes back to the philosophy of union or yuj, which is this connection. It's this harnessing of our energy, both physically, through the breath, through our intention, through our bodies, our joints, our muscles, and weaving it all together. So we become stronger, more connected, more tethered to the core of ourselves. All right, I hope it's sparking your interest a little bit. Structures in systems. Now, we're not going to dive into the details of every single one of them, but here's our base skeleton. You have the integumentary system, which is more of your skin, your hair, and your nails, very surface level. You have your muscular system, which will focus on consisting of your muscles surrounding your skeleton. You have the cardiovascular, your heart, your arteries, your veins, your respiratory system, your nasal passageways, your trachea, your lungs. Thank goodness for them. Your digestive and urinary, consisting of your entire GI tract from your mouth to your anus, includes your stomach, your liver, your gallbladder, your large and small intestines. The urinary consists of bladder, kidneys, and urethra. Again, we're not going to go through all these systems, but just to have even here, like, wow, there's a lot happening in my body. The endocrine and reproductive system, your ductless glands that produce your hormones in your body, includes your pancreas, your ovaries and testes, um, and more of our sexual organs as well. Again, this is like just the awe of like, wow, y'all, there is a lot of information and movement and work happening always without even our awareness. Lymphatic system, super fascinating in itself. This is your lymphatic vessels, your lymphatic nodes, your spleen, and your thymus. It's basically like the garbage disposal of our system. You have your nervous system, which we will dive into through training. That consists of your brain, your spinal cords, the peripheral nerves, that fight or flight, that rest and digest. Then we have our skeletal system, which we'll dive into. This is your bones, your cartilage, your ligaments, and your joints. So it's very complex, really touching the iceberg, but here we go. So our beautiful skeleton, it consists of your bones, your joints, and your teeth. The bones of the skeletal system are connected by tendons and ligaments. And the skeletal system has a few functions. One, it supports the body and gives it shape. If we didn't have a skeleton, we'd just be like a lump of muscles and meat and arteries and veins. There would be no structure, the vessel. And then it enables movement along with the muscular system and our joints, which is amazing that muscles contract and hinge and bend and rotate joints so that they can move pretty organically and quite miraculously. If they're running to dance to our yoga practice, all of it is fascinating. It's protecting the internal organs like our sternum, right? Our heart, our ribs, our lungs, our vital organs. It stores calcium, produces red and white blood cells. A baby, this is cool, has around 350 bones, while an adult has approximately 206. So a baby is, a little bit more gelatinous, you could say, a little bit, they're a little bit more wormy and soft. And as we age, those bones, they start kind of fusing together. So it drops quite significantly as we age. Major bones in the body. We have, and please move with me, right? Your collarbone, this is your clavicle. These bony processes across the chest. The center of your chest is your sternum, protecting the heart. Maybe even feeling that right heart expand. Your upper arm bone is your humerus. And I do recommend you continue to follow with me. If you stick your thumb up and you move your arm down, unsqueeze, this is your radius, the lower arm bone facing the sky. Underneath is your ulna. And how I like to remember this is thumbs up like a ray of a sun is your radius on top. Ulna, you, underneath, ulna. It's a bony, gelatinous piece of really cartilage. Your pubic symphysis, and anyone who's delivered a baby might feel and know and recall the sensation of that kind of separating. It can feel very unpleasant. You have your patella, your kneecap, your shoulder blades on the back side of your body, your scapula, those wings, shoulder blades, scapula. If you bring your hands to your hips, you have your ilium. They're like kind of a bowl of the pelvis. Your low back that sits right in the ilium is your sacrum, which is actually 5 fused vertebrae. Your upper leg bone, largest bone in the body, give it a little squeeze, your femur bone. And then rub your hand down the front of your shin. That's your tibia, the one that you can feel. And then the smaller one off to the side is your fibula. So take a moment and pause. And of course, you can come back and review. Notice how the upper body, like the hips, the upper arms, the lower forearm bones, mirror the lower body from your hips to your upper thigh bone, your leg bone, and to your lower legs. It's fascinating when we really take a moment to look at the structure of who we are. And we don't go around in the world and associate like I am the skeleton, right? It is the vessel. It is giving us this energy to move about through life. So take some time to review, recall, and remember the major bones in the body. Now, the spine, the structure of the spine. We have segments of the spine. So take one hand at the base of your skull and feel that bony process. You have your full spine from the base of your skull all the way down to your tailbone. So around your neck, we call this the cervical spine. There are 7 vertebrae. And if you drag your hand down, eventually one of those is going to stick out a little bit around 7. That's the 7th vertebrae. So from 1 to 7 is your cervical spine. Underneath that, we have 12 vertebrae. Bring your arm towards your rib cage. It's housed in the rib cage. There's 12. Think about 12 ribs. You have 12 vertebrae for your thoracic spine. Your thoracic spine, your upper, mid to upper spine. Then we have our lumbar or lower back, our lumbar spine. Now bring your hand to your low back. You might not feel these as much if you do a little bit of movement. There are 5 vertebrae back here. And then underneath you feel that flat bone is your sacrum. And that's 5 fused vertebrae together, which sits within the pelvis. It's fascinating. So, how do we remember how many vertebrae in each portion of the spine? Silly mnemonic device, but I find it really helpful. What time can you eat breakfast? 7 a.m. in the morning. You have 7 cervical spine vertebrae. Thoracic spine, you eat lunch at 12. You have 12 vertebrae in the thoracic spine. Dinner, let's say you have it at 5. 5 vertebrae for your lumbar spine. And then the sacrum looks like a little pie, 5 fused. So 7, 12, 5, and 5. This is our spine. Spinal movements. Now, this is really important because when you're practicing, let's say the next time you go to class, notice how much the spine moves. And with any, in my mind, healthy class, our full body class, we should be moving our spine in every direction. And really, if you come to any one of my classes, I really prioritize moving the spine in every direction. So we have, if you're sitting, hands on your knees and roll into cat, this is flexion. Your spine is flexing, it's rounding. Pull your chest forward, come to cow, that's extension. You're extending, your back bending. Think of your spine now and laterally flex right and left. So bend to the right, bend to the left. Side to side bending, lateral movement of the spine. Then we have rotation or twisting. We can rotate to the right and to the left. Now do that one more time. Sit tall and rotate. Notice what area of the spine feels most mobile. The cervical, right? When you sit tall, you start rotating with the low back, then your thoracic spine, but then the head continues to rotate. And then we come back through center and do the other side. So a lot of our day, we're very sedentary, we're sitting still, we're very stagnant. Your spine needs movement. That's where it houses your central nervous system. That's where energy is moving from your brain throughout your body. So awake and alive in your spine, y'all. Axial extension is a tricky one. This is lengthening. So when you're standing really tall in mountain pose, or you're trying to lengthen your spine when you're in Sukhasana or a cross-legged seat. So getting used to, okay, I'm slouching here versus sitting really tall. And if you take anything away from this, I hope you start becoming a little bit more aware of axial extension on and off the mat. Like, how are you literally holding your spine when you're working, when you're at dinner, when you're walking around? Aim to sit a little bit taller. All of us. And this way we can just right away begin to take yoga off the mat in a very practical way. And it's something I've been working on for, oh my goodness, well over a decade. I think almost 15 years of just slowly becoming more aware of my posture. And yet I still catch myself slouching or rounding in and overly flexed positions. So it is a practice that requires practice day in and day out. All right, our connective tissue. So we have our joints, and in the joints, it's connection between the bones, the body, which are linking, like webbing, the skeletal system into this functional whole, that it's not just separate parts, now it's a whole. They're constructed to allow for different degrees and types of movement. So we have main joints. You have your hinge joint, which would be your elbow, if you want to move your arm, and or your knee, that extension and flexion of your knee, which we'll get to a little bit. You have your ball and socket joints, shoulder, hip, right? They mirror each other. And then you have your pivot joint, rotation of your head. Some people put wrists on there as well as ankles. Those joints are a little bit more complicated because they flex and extend, and they also rotate and pivot. Regardless, these are our main movements of joints. And then how is the body actually put together? So we have ligaments and tendons that are making up the whole or the joint. So your ligament is attaching bone to bone. So think of the knee, the inner knee, imagine it. Now, if you've ever had surgery on your knee, maybe you had an ACL injury. ACL is actually talking about the anterior cruciate ligament. It's attaching one part of the inner knee to the other, actually, and what happens is there's a strain or a tear that happens in a ligament. Whereas a tendon is attaching muscle to bone. So if you bring your hand and feel the back of your ankle, you feel that rope kind of quality. That's your Achilles tendon. That's attaching into your, if you follow it up, into your calf. And then if you follow it down, it goes into your heel or your talus, your heel bone. So muscle to bone. And that's where we would have a sprain. Wild, right? So ligament is bone to bone. And you can see that like those white tissues on the skeleton right now. That's the ligament that really are surrounding all major joints in the body. And then your tendon is muscle to bone. And to review, we have our main joint movers. We have our hinge joint, ball and socket, shoulders and hips, pivot joint of our head. All right. Brief anatomical orientation. So the front side of your body is anterior. The back side of our body is the posterior. So the shoulder blades, the glutes, the hamstrings, the calves, which we'll dive into later on in terms of our muscles. When we're looking at yoga, there might be a class or instructor that says, come onto the posterior side of your body, or that's on your back body, or lie down on your front body to work and engage the posterior chain of the body. So think of belly down and looking at like locust pose. So locust is belly down, you're contracting the muscles along your back and your glutes and your legs, you're working the posterior chain of the body. Or if you were doing like core exercises, you might be traditional core exercises, you might working your anterior, your front body. And here, that's really all I want you to know is the front, anterior, and posterior portions of the body. If this is more curious to you, of course, you can pause and dive in. All right, the pelvic tilt. This is something I'm really passionate about and very much connects, obviously, clearly to our posture. So if you're seated right now, tilt your torso forward and your tail back. That is an anterior pelvic tilt, and that puts a lot of pressure on your lower back. Then you have a posterior tilt. Gently begin to tuck your pelvis, lean back and round. This puts a lot of pressure on your low back, but in the opposite vertebrae. And this is a very common way people are sitting, especially when they're working, they're driving, or they're sitting for meals. Then sit up. Forward shifted pelvis or swayed back is when people are standing, predominantly when their knees are locked and they shift their pelvis way forward. So you're straining your knees, you're straining your hip flexors, and your low back. Now, unfortunately, most human beings are unfortunately standing and kind of seated in one of these not so beneficial pelvic tilts. If you are sitting a lot, you're probably in that posterior, that tucking of the pelvis. We see a lot more hypermobility in female bodies, so you might have that tendency where your kind of hips tuck forward and you're really swayed in your low back. And just start being mindful of that. And we'll explore that in our physical asana practices too, and what that feels like in the pelvis. But even here, start rounding the pelvis and posterior, that word, posterior, tucking the pelvis, and then that anterior coming forward. Posterior is going back, anterior is going forward. And you want to imagine your pelvis like a bowl, and you don't want to tip the water forward or let it leak out the back. We want a neutral pelvic tilt, balanced posture. And then you can see the spine is a lot more in axial extension or lengthening. there's a lot more stability there. And there's a lot more amazing blood flow happening to our organs as well. So please, please, please just start noticing your tendencies. No need to judge, just simple awareness of what's going on in the body. Okay, just a few more slides. Movement terminology in our joints. So we have flexion, that can be bending the elbow or the arm is moving straight up. That's decreasing the angle between 2 points. It's bending. When you kick your heel to your butt, that's flexion. Extension is when you're straightening your arm, or extension is when you're kicking your leg forward. That's increasing the angle between 2 joints. It's straightening. Extension for the shoulder would be going back. You're increasing that angle. You have adduction. If your arm's far away and you're pulling it to your body, that's adduction, ADD, moving energy in towards the midline of the body. And then ABD, abduction, is when the arm or the leg moves away from the midline of the body. So if I say inhale, sweep your arms wide and up, you are abducting your arms away from your torso. Then we have internal rotation and external rotation. So internal rotation is when you're giving yourself a hug or you're taking eagle pose. That's internal rotation, laterally rotating towards the midline of the body. External rotation is arms reach back and you clasp them. External rotation is standing with one leg in tree pose. You are rotating externally away from the midline of the body. And again, we want to move the body, the hips, the shoulders in all these different planes. Think of movement for your joints almost like you're flossing in the joint capsule. Now, this image isn't on here, but we'll do it together. When you're seated, elevate your shoulders up. This is elevation. Decompression, shoulders draw down. Retraction, shoulder blades hug towards the spine. Super important. I personally cue this a lot, or hug your shoulder blades to your spine. And then protraction, shoulder blades move away from the spine. So round your back like cat, that's protraction. Most of us are already in this rounded shoulder position. So for our personal practices, like think halfway lift the next time you come there, think about squeezing your shoulder blades towards the spine. You want to strengthen the muscles of the shoulder blades towards the spine, so then it will help us to sit taller. Like even here, let your shoulders roll forward and then gently squeeze them, not 100%, but gently squeeze them, and notice how the heart, the chest opens a little bit, and then you also sit taller, which feels better and easier. Try breathing. Easier to breathe. Wonderful. Few more movement terminology. Supination, turn your hand up. That's rotating your palm, your forearm up, like you're holding a cup of soup. Or when you're on your back and the teacher guides you to take a supine twist, that's knee over your chest and you're rotating. You're supine. Or supta baddha konasana, when a teacher has you start class reclined on your back with the soles of your feet together and your knees wide. So that's supta. Again, supine, you're on your back. So it indicates where your body's position is. Pronation is when your belly is down. You're rotating your palm down or your forearm down. You're lying on your stomach. You're prone. Dorsiflexion, if you can bring one leg out in front of you and flex your toes to the shin bone, that's dorsiflexion. I think of like a dorsal fin of a dolphin, toes to the sky, dorsiflexion. Plantar flexion is pointing the toes away from the shin. And I remember that mnemonic device of plantar, P, to pointing my toes, plantar flexion. Dorsal flexion, toes to sky, dolphin pose, or like a dolphin rather. Plantar flexion, pointing the toes away. Please move ankles and wrists in all ranges of motion to clear that stagnant energy. And then we don't really explore this too much. It's very subtle in practice, but with your foot, eversion is rolling to the inside of the foot, and then inversion is rolling onto the outside of the foot. So everyone, when they're standing, especially in like balancing poses, has a tendency, for example, in Warrior 2, the back foot, the outer edge of the back foot should be pressing down. But what happens is we're everting, we're rolling to the inside of the foot, that back foot in warrior two. So we want to use a little bit of inversion on the foot. Do not worry if it's all like, what's happening? That's okay. That's exactly how I felt. But just let yourself be a sponge. The things that excite you or make you really curious, explore that now and like let everything else linger and dissipate. And then it will come back to you. Okay, so we learned and we covered a lot. And my whole intention is for you just to be a little spark of curiosity of like, whoa, I'm unlocking, I'm uncovering a whole new portion of this practice. So, what is one new piece of anatomy knowledge that surprised you? And then you can always review and go back. What is one anatomical area of your body do you want to be more mindful of and why? Like, oh, I didn't really pay attention to my low back before and my pelvic tilt. And now I'm like, I want to stay alert for that. Or I didn't notice my shoulders were rounding in. I want to work on retracting my shoulder blades a little bit more to my spine. How might anatomy awareness help prevent injury in the practice of teaching? And that answer is for you, open ended, and all of these are. There's no right or wrong answer. I'm more interested in your building a connection to your own body and eventually maybe when you teach rather than remembering every single bone and or joint or muscle in the body, which of course please review and educate and keep repeating and exploring and learning, but that's not the point. The point is, how is this making you feel more connected to your practice and hopefully inspired, maybe in your teaching? So, thank you so much for joining, and I hope to see you soon. Next anatomy lesson is the introduction to your muscles. Cheers. Blessings. Stay kind.